Well, the pandemic is still at least a week away from the projected peak in Florida, and cases jumped by more than 1,000 in just 24 hours. The state now has more than 21,000 cases. Nearly 14% of people sick with the virus are hospitalized for care. The death toll is just under 500 people. The Bay Area alone has more than 2,300 cases and 79 deaths.
I can only pray and trust God to keep her safe, but it's very scary not knowing, like, if I don't feel a kick for a few hours, I'm really worried.
Out of our Sarasota County Bureau this morning, a woman is scared and sick with COVID-19, and she's pregnant. One of her symptoms, she says, is shortness of breath. Yana Rybin says she wasn't too worried about coronavirus until she tested positive herself. She's halfway through her first pregnancy and says even the simplest activities like doing a puzzle makes her feel out of breath. Her message for others this morning: take it seriously and stay home.
I just want people to wear masks, to wear the gloves, just be extra safe. I'm sorry, because when it hits your lungs, it's scary.
Rybin's doctor says the good news is a healthy pregnant woman isn't at an increased risk of complications when compared to any other person. Rybin says her plan now is to take it easy and stay quarantined at her home with her husband until she recovers.
Well, COVID-19 poses a much greater risk to seniors, which is exactly why Florida will start targeting long-term care facilities for even more testing. Governor Ron DeSantis is directing the National Guard to increase testing of both staffers and residents within nursing homes and other care facilities.
One of the things that we've learned is you can have someone come in the staff, you can do a temperature check, you can check for symptoms, but people do carry this virus without a fever, without being symptomatic. And so you need to have a strike team going in and aggressively testing to try to preempt that.
Governor DeSantis says this increase in testing will start in the hardest hit areas of the state, which, as you can see on the Department of Health's map right here, is mainly in southeast Florida right now.
Almost everybody is on oxygen, and almost everybody is a COVID patient. We have every patient in here on a ventilator.
So this is what it looks like right now inside the Mount Sinai Brooklyn Emergency Room in New York. 8 on your side, obtaining this video from a Bay Area doctor, Melanie Malloy. She's working in New York during the pandemic. Malloy explains the hospital is packed full of COVID-19 patients, all in critical condition. She's working long hours to help them and balancing that with being a single mom of 3 kids.
And I don't really have a lot left in me, you know, so I struggle with that because I wonder how much my children suffer from me kind of giving everything at work.
Dr. Malloy is urging people to stay inside and says her biggest fear is that the rest of the country could end up becoming like New York. And there's much more to Malloy's video blog from a day in the hospital. You can watch her entire video right now on our free WFLA app. And the pandemic is taking a toll on people as stress and grief are top of mind. That's why the local organization Directions for Living is providing an outlet for people struggling with those feelings. 8 on your side's Deanne Roberts joins us live in Tampa this morning with how they're helping people cope with this stress. This is a lot, Deanne.
Yeah, this is a lot. I mean, everyone responds to an emergency in different type of ways, but this one in particular is just hard to grapple with. That's why Directions for Living has this emotional support line open to just help people get through this difficult time. I mean, people are stressing about the pandemic within itself, being in isolation, fearing what may come next, or even grieving the loss of someone or something. The Directions for Living emotional support line is for people to express their feelings and get support from licensed mental health professionals who are letting them know they are not alone. The support line is open 7 days a week from 8 a.m. to 8 p.m. The number you need to call on your screen if you need their services is 727-524-4464, extension 1001. We will have this information on our WFLA app. This support line is getting 50 to 60 calls a day. That number is growing daily from people of all ages, especially teenagers.
Some of the calls that we've gotten have been from teenagers who are grieving the loss of their high school graduation, the loss of their proms, early admission to college, and all the things that you know that our adolescents and teenagers are going through and considering. And I think that we need to validate and respond to those.
It's a hard time for many people here in the Bay Area and across the country. So Directions for Living, after you call, they actually call and check on you the next day and throughout the week. And they're actually urging people who do call to go ahead and call 2 to 3 of their family members, their friends, and check on them as well. You know, Avery, we've been saying it for weeks now. We all have to stay together and just be there for one another during this time.
Exactly. And self-care too, Deanne, is something that is so important right now, as well as we all try to get through this together. Thank you for that.